The analysis we did was we had tissue from over 500 patients, plasma from almost as many, and then we had urine from over 200 patients, and the urine was a secondary test, so not all the patients participated. But what we did was we looked to see, could we find the T790M mutation in all of those different platforms. And so we had different ways of looking. We had two different tests for the plasma. One was the beaming assay, which is a bit more standard. The other one was the Travera NGS analysis. And it was that same technology that's also looking for the urine T790M, and then for tissue testing, that was more standard COBESS testing, the QIAGEN. So what we did was we then looked across these different platforms about how frequently could we find the T790M. And actually the sensitivity of all of the assays is quite good. And we were showing that we could find about 80% sensitivity for the T790M with either of the plasma assays as well as with the urine assay. And what's particularly interesting is when you look at the sort of how they all intersect, for most of the patients you were able to find the T790M by all three assays. But there were subsets of patients where you only found it with the plasma assay, or only with the urine assay, or only in the tissue. And when we look back to see, well, how did that correlate with drug response, it didn't matter how you found the T790M, whatever way you found it, that predicted for drug response. So it kind of tells us that it's not that you're getting false positives, it's more that there's some false negatives. And for tissue, that's more likely tissue heterogeneity, where you might have a specific piece of tumor biopsy, but that's not necessarily where the T790M. And then with both the plasma and the urine assay, it has more to do with the sensitivity of the test. So from a practical standpoint, I think what it tells us is that we can definitely consider doing either the urine or a plasma assay to look for T790M in our patients with EGFR mutations who are now becoming resistant. But if we don't necessarily find the T790M that way, we shouldn't say, oh, they don't have it, but should then think about doing the tissue analysis. So that was really the take home from it.